Coming up next is a session with Atish Majumdar, Senior President at Mankind Pharma, where he is responsible for leading Mankind's specialty businesses. He also serves on the board of Actimedia Therapeutics UK as a director. Atish has been in the Indian pharma industry for close to 3 decades now in general management and operational leadership roles. Prior to Mankind, he was with Lupin for 21 years. A believer in the transformational power of digital interventions and people development, he has successfully initiated, executed, and driven various digital and people interventional strategies which have helped transform processes, outlooks, and business outcomes. Today, he will speak about reputation from the lens of a leader. After his keynote address, Atish will be in a fireside chat with Sarah Rajan, partner at SPAG Fin Partners. Atish, may we have you on stage, please?
Good morning, everyone. My friend Aman, who is with Fin Partners, gave me this very difficult task of speaking on reputation, especially since I come from the pharma industry, And if you look at the various reputation reports across the globe, government, tobacco, and pharma, that's the bottom three, right? And so I'm here to speak to you about this, but since COVID happened, I think pharma has gone through a different trajectory, and maybe that kind of sets it up for me to talk to you. And I'd also like to thank Reputation Today and Fin Partners for having me over here. I will begin by showing you what I saw yesterday in the morning, This was there in the Times of India. Elon Musk, if you look at it, his per day worth has gone up by $3.6 billion per day after Donald Trump won the elections. And perhaps this is the kind of manifestation reputation has in today's world. We wouldn't have seen anything as big as this. No product launches, no new acquisitions, and yet one single move which enhances his reputation, and this is the way it is monetized. Now, this is a very basic slide. I think all of you know this. Reputation today, in today's world, is a strategic asset. And I think professionals across industries today understand this and work to enhance it every day. I think the elements broadly remain the same across industries, and so does the benefits. But when obviously I'll be focusing on pharma more, I will show you drivers which are perhaps a bit different from what we see here broadly. Now, we are there in the pharma space, and we are there in industry overall, we are there in business. It's important to understand reputation as a word, as a subject, as something that we do, has changed with times, right? And basically, if you look at businesses and if you look at how this word has changed, has been driven basically by the capitals of business, by how we consume, and technology per se. If you look at business capital, for hundreds of years back, thousands of years back, it was always about money. You needed money to start a business. There were nobody financing you, right? So money was the first thing that you required to do business. That was what we call the financial capital. And from there, we learned about OPEX, CAPEX, and everything. Then it went on to natural capital, right? You understood about raw materials. You understood about locations. You understood about putting up a manufacturing hub near a river or where labor is easy. All these things came into business. And so businesses which had great natural capital started doing well in the world. And then somewhere around the 50s, through Siemens, we learned about managers, and we learned about something known as the human capital. And so suddenly human capital became very important and became a big differentiator in business, goes even today. But with the advent of the digital world, with the changes that we see today, organizations today have much more capital to work on. Their cognitive capital, in spite and despite the turnovers that you have or the market capitalization you have, cognitive capital, behavioral capital, network capital can either erode or add to your market capitalization. And this is what we perhaps call social capital today. And every organization today, at the board level, at the CEO level, today have to understand that these are critical elements of organizations which wants to sustain and grow in the years ahead. So this is one change which has driven reputation today. So what happens when I talk about social capital? Essentially, it is your reputation as a company, as a brand, as an employer in the marketplace. So this is one change we see. The second one we see is consumption. Today, we always knew consumption, but today what we see is collaborative consumption. This is very, very simple. It's a new social economic force which is kind of rewriting and redefining how we consume, what we consume, and what do we do after we consume. So imagine this, I bought a book or a DVD which I want to see. Say it's Mission Impossible. Now I've seen it all, right? Now what do I do with the DVD? It just lies in my house, right? But with the advent of technology and the new digital world that we live in, we can perhaps exchange our DVD with someone else. It's a shared world, right? We consume together. And what's important to understand, companies like this that you see over here, they have built their entire company on these consumption patterns. And the important thing over here to understand is, we are not talking about consumer buying behavior over here, but what I am trying to essentially say is, when you look at these companies and when you look at their customers, you will realize the transaction is between a stranger with another stranger. And the bridge, therefore, is trust, which in many ways is reputation. If I book a flat somewhere in London where I'm going to stay there for my holiday, right, I don't know anything about that guy, but I look at the reviews, I look at the reputation of the place, and then I make my decision. And this reputation of these places, this shared services, is what is reshaping the world today, and it has fundamental impacts on how business is done today. And if you look at companies, you have people who are founders, who are entrepreneurs. But this new world that is shaping up right in front of our eyes has micropreneurs, for whom reputation is the biggest asset of all, right? You can't sell your service, you can't share your service, you can't monetize your service till you don't have a good reputation. The technology impact. These three brothers that you see over there has completely changed our world. Social media, smartphones, AI. And I always say this, it's a connected world which has been completely rewired by a wireless world. And we do everything over here: share, swap, rent, barter, trade, influence, everything we do over here. And it's important to understand this entire behavior, right, is driven by something which we are discussing today: the reputation of both the buyer and the seller, right? Today, it is important even for the seller to have a good reputation. Even they get ratings. You get it on Uber, you get it everywhere. And the most important thing to understand how reputation has changed today is, earlier you had a reputation. It was like a shadow, it went with you. But today it goes much, much bigger than that. It transcends nations, oceans, because you have this global reach. You have real-time perception of what is going on. People can publish anything they feel like, anytime. User-generated content, everybody can contribute. And most importantly, though I believe this is some way for all of us to travel, is data-driven insights. I think this is what is shaping up reputation today. So just to sum it up, for companies, reputation looks like an asset today. For the individual, it's important to understand that the economy which is shaping up, the consumers to whom you are selling, whatever you are selling, has completely changed, and reputation today is very, very important. Whether someone is purchasing a medicine or going to a doctor even, anything, reputation is so very important and completely driven by the technological impact that has shaped our entire world today. Now, reputation in the pharma industry, right? We, like I said, we are a bit of a different industry. I mean, every industry talks the same way, but nevertheless, I believe we are a bit different. Innovation is the cornerstone of our reputation, right? As a pharma company, the expectations is that you will innovate and find out an unmet need for a disease. See, what's important to understand is medical science, unfortunately, is the most retarded of all sciences, right? Actually, you know, till today, there are 14 diseases only which has been cured. The rest has to be managed, right? You would find all of the science. Science is all about solution. Technology is about making life easier. Medical science is about just living your life, right? And so innovation right up there. The leadership team, very, very important. So regulatory is very important in pharma. How you behave is regulated today by the government, by consumer bodies, and by medical associations. Capital, important to everybody, but the social capital, very important to pharma. Products and services. You know, you get in the product. If you have a bad quality ice cream, nobody complains. You have a bad quality medicine, you're right there, you know. CSR activities. As a pharmaceutical company, you are expected to do it more than any other industry is, simply because the general perception is pharma always overcharges you, right? Financial performance is equivalent to every industry, and your operations. Today, with the Internet of Things also growing along with AI, it's so important for pharma to partner with the right partners to see that the right manufacturing processes are being done, the right packagings are being done. So operations for pharma becomes critically important. So this is what reputation in the pharma industry is. You go wrong in any one of the places, you will see your reputation index has gone south. You do this well, not enough, right? You have to consistently do this well and make this whole cycle visible to the patient and to the doctor. And then perhaps your reputation starts moving in the right direction. I will talk to you about some cases very quickly. The first is Ranbaxy, very close to our home, right? They kind of messed up the regulatories, especially in with certain drugs like gabapentin and ciprofloxacin. They had to pay a $500 million fine, but the fine is not what we are talking about. The intangibles which this company had to pay is, it no longer exists today, right? In 98, 99, this was the #1 company of India. Today, it does not exist. Simply, and this whole cascade really started with the FDA warning and the FDA penalty, and today Ranbaxy is a Sun Pharma company. So the consequences of a bad reputation in pharma can be devastating actually. GlaxoSmithKline, another regulatory violation where they influence guidelines and really try to see that their promotional tactics with doctors in terms of kickbacks, especially in China, was not in line with regulations. And they paid a fine, which is $3 billion to settle this. Now, in this case, if you see, there was a trust erosion, yes, but the company then went totally compliant. And today we see that their reputation is traveling in the right direction simply because they stood up and paid these fines. See, normally you would not hear this kind of reputation or policy violation, deviations being fined in any other industry like you'll see in pharma, because we deal with the lives of human beings. This is another one. Tylenol is a paracetamol basically of Johnson & Johnson, right? They found impurities in Tylenol. And what they did is they called back stocks worth $1 billion nearly. 31 million bottles was called back. And this led to a fantastic reputation because this was initiated by Johnson & Johnson itself. It was not a regulatory body telling them to take the bottles off the shelf. The company did this, and within a year, in spite of that bad reputation, they went up 30% market share within 1 year. What I'm trying to tell you is that, Abraham Lincoln told this a long time back. He said, a tree is your character, and a reputation is your shadow, right? What is most important is that the shadow can be anything, but the tree has to be really, really solid. And it's important to understand the reputation enhancer here was the value-driven action of Johnson & Johnson. So these are some of the cases of the pharma industry, and normally more often than not, you'll find that different companies at different periods of time have been fined for violations. But came COVID, a small little virus, right? And this small guy made healthcare the most important thing in everyone's lives. For the first time, people gave up their marks, gave up their anything they were pursuing in life, their ambitions, and settled at home. And people understood for the first time that your body perhaps is the most important thing, the most important asset that you have. And it worked wonders for pharma, because what we always do is we believe the first prescription is awareness, right? Second is education, and then comes the drugs. COVID did a huge job of making people aware, worked for pharma. And see, like I was telling you, government is right at the bottom, but you look at it, pharma went for the first time after COVID, the reputation of the industry went up. Initially it did not, but with the way, especially in India, I think the pharma industry did a fantastic job. In spite of constraints, there was no supply challenges with the drugs. For small periods they were, but it was nicely navigated. So come COVID, and pharma went through a different trajectory. And obviously, the opinion, like I told you, changed for pharma, mostly positive for a change, basically driven by frontline essential workers and so many people getting infected and benefiting from medicines. And one case here about innovation. See, if you look at Moderna, in 2020, it was literally not a company, with a market capitalization of $6.52 billion in 2019. And with a turnover of $18.5 billion in 2 years, it had a market capitalization of nearly $103 billion. The power of innovation. When you do something which people need, especially in the pharma space, and you deliver on that, this is what happens to you. Again, you would not see any innovation in any segment of the industry travel at this pace at which pharma does, right? So the biggest reputation enhancer in pharma continues to be innovation. What do we do at Mankind? The first thing is we realize your reputation is important. Very, very important, both with your doctors and with your patients, and no general public, because every person today has a body and will someday or the other fall ill and will take a medication. So, ours was a story which started in around 95. Around a period of 29 years, we have traversed and become India's #1 company by prescriptions. And this whole story came from one idea, making affordable medicines accessible to all. And from there, we went to quality. We launched India's first DMF grade API brands, which basically means the quality that you require to launch in the US, we launched here. It is a comparison with the innovators, and we launched it at Indian price. So one drug would cost $14.50 in the US, will cost about 10 rupees in India. That's the innovation we did. Market leadership, it's very important for your reputation. Customer focus, what you do with doctors, how do you create knowledge platforms, how do you enhance their knowledge itself is very, very important. Innovation and collaboration. Innovation is you try to find out an unmet need. Today we have 3 new chemical entities which is in the public domain, and one of them is a diabetic drug getting into phase 2 trials, which should address some unmet needs in diabetes. Collaboration, we partner with Big Pharma today, AstraZeneca, Novartis, to bring in patented products which can make a difference to the lives of Indian patients. Media, social media presence, both is very important to us. And I'm sure you will see if you put all companies together, Mankind will be there right at the forefront. And CSR activities. All this driven by our core values, which is making medicines affordable to patients, which in my mind is the biggest patient assistance program you can probably have. The imperatives for the future. Digital imperatives, I think for every company today, it's important to understand that you have to navigate both the virtual world and the real world. And you have to do that with data, with AI, and using all this. And in pharma, there's one more thing you should be very, very conscious about is how you use IoT. Leadership imperatives, I think for every organization, very important that leaders understand the importance of reputation and the importance of building organization culture and employee advocacy. So very important for your reputation. The last thing you want is your own people talking badly about your organization. And product and service imperatives. At the end of the day, what kind of products you have, what services you provide, how efficient it is very, very important. The future of every organization, the way I see it, is to build on their reputation capital. And it will basically come from trust, which is efficiency and quality. The core has to be good, right? And social networking will slowly shape up into service networking, which is already happening. And that again will be driven by trust, which will lead to your reputation. Finally, my belief is the currency of the future will be your reputation capital, right? Everybody will have cards which will kind of tell you what have you done in the past, what do you stand for, and what do you believe in, and what do you do. Reputation, all of you know as professionals, are by far the most important thing that organizations are working on today, whether it be their product, their services, their cognitive capitals, their behavioral capitals, or their networking capitals. Thank you very much.
Thanks, Atish. I think that was really interesting and very good to know about reputation from someone who spent about 3 decades in the pharma industry. And as someone who's working very closely in the healthcare sector, I think this was very interesting and exciting to see some of the case studies that you also put up. But I want to just start with asking you a very basic question. What does reputation means to you? Like, I know you took us through a whole presentation, but what does Atish really resonate with reputation? What does it mean to you?
I think it is what people perceive you as in terms of your trustworthiness, in terms of your credibility, and in terms of your desirability. I think these 3 things are essential when I look at the reputation of a brand. And also the experiences that the brand creates. That ultimately leads to a reputation. And when we talk about experience, obviously the customer experience, the product experience, and the people experience. All 3 is very important. And here I think it's important to understand when we talk about experiences, it's about expectation minus delivery. If the delivery is better than the expectation, the reputation goes up, right? So it's as much about shaping expectations as it is about delivering beyond those expectations. So that's the way I look at brand reputation.
Yeah, I think, you rightly said that, trust actually is paramount where reputation is concerned. And I know Priya did say at the morning session, it takes years to build trust. And especially in the healthcare pharma industry, you've seen a whole change, right? I mean, now you're living in a world of connected information. So how do you see reputation has played a pivotal role? Because before this, of course, people did not know which company the medication was coming from, but today they do know. Post a COVID world, we are living in a more informed world, right? So, but how do you see the change has happened, and do you think we have sort of pharma industry has accepted and adapted to this change, or there is a long way for us to go?
I think we are learning along the way, like the rest of the world. It's a new world, it's a connected world, and a very transparent world, right? And pharma was not very transparent quite some time back. And today, I think being transparent is one of the first responsibilities of pharma, right? Telling people what do we do, how do we do it. And the second part of it is that whenever you talk about reputation, for us, there is one middle person to whom the reputation is very important, right? Because our consumer most of the times really don't know. So if you're taking an anti-cholesterol drug, it would not manifest. There are no symptoms, right? So the decision maker here is a doctor. So he has certain metrics which he looks at when he really looks at making a decision regarding choosing pharma companies. And it's important also to understand that whenever we look at the Indian pharma market, this is a unique market. We are a branded generic market, which basically means we have generics. We also have brands, which means a rosuvastatin brand, which is a cholesterol brand, would have around 78 competitors, kind of priced very, very within the same price range. So for the doctor, what happens is the quality of the brand, the perceived reputation of the company in terms of the quality that they make is very important. What is the quality benchmarks they have? How do they really standardize their drugs? These are very important. What is the assay purity of the drug? Very important to a doctor. And also the pricing. And if you have got some innovation, obviously he will jump at it. So these are the things which becomes very important when you look at a pharma reputation. But you rightly said it has changed a bit. Now you have a very informed patient today, right? And so your online presence and what people talk about you becomes so very important. And your social listening skills is a critical driver of reputation today. If you ask me personally, I have always felt influence was the driver of leadership in a world which is not digital. But response is the driver of the world that we live in today. We heard earlier days, politicians coming and giving big talks, influencing everybody, But today it's all about response. If you look anywhere, people like to see how does this person respond. So for pharma also, in the digital space, your reputation is all about how you're responding, right? How quickly people will always come up with some grievance, but how quickly you respond is very, very important. But I think in a nutshell, reputation very important for pharma now, because most of the companies, especially in India, the big companies are all there in the market, and you can have your market capitalization completely swing based on adverse feedbacks that come in.
I think, just moving away a little, it's sort of a chicken and egg situation, right? When you say, I trust a company because it's reputed, or because it's a reputed company because they have the trust of the consumers. Which one would you put first? Would you say it's trust which leads to reputation, or would you say reputation of the company that is leading to trust? Out of the pharma world, just as a consumer, how would you...
I'll tell you something. Reputation is like a relationship, right? You have a relationship with what you think the person or the company is all about, right? And how do you build a relationship? A relationship is based on trust. What is trust based on? Truth. If you don't have truth, you don't have a relationship going, right? In life and in business, everywhere. I think that's the change fundamentally which is taking place. So I would go with trust.
Okay, that's interesting. And when you say trust, do you think patient access programs or patient programs or community outreach programs with shared value propositions, do you think they add a layer of trust and reputation to the brand? Or do you think consumers look at it as, because everyone knows now that, CSR karna hi hai, has to be done by every company, so they are doing it. Do you see that, or do you still see value in community outreach programs, Atish?
So like I told you, truth is very important. And finally, your consumer sees it. When you do patient assistance programs or patient awareness programs, there will be people who come and distrust you. They feel that this is you're doing this just to see that you sell more. And there is an element of fact in it, but that's not the whole story. There's a bigger picture to it, right? I told you while I was speaking, in the world of pharmaceutical medicines, in the world of healthcare, the first prescription a doctor gives you is awareness. Then he gives you education, and then he writes a prescription, right? This is how it happens. Just look at any doctor you go to, right? This is how this whole thing flows. So what's important to understand here is when you go and do this awareness programs, when you do this diagnosis programs, your fundamental, your core, your seed is based on truth, which is that you're helping the patient understand, identify something which he or she does not, right? And here, that perception which the patient has at that point of time is incidental, because as the patient travels on the journey with the disease, the patient will be grateful. So it's very important for the reputation of an organization, especially in the pharma space, to do something for the therapy, for something for the patients. It goes much beyond CSR projects.
Okay, so you're saying that patient programs definitely.
Yeah, we are humans first, right? We want people to be cured. We want people to be healthy.
Yes, but you know, because there is, like you said, there are some elements that really go against the pharma world, in the pharma world at least. But yeah, I take your point. I think patient programs, you say,
Like I said, you do the right things. And that is why pharma companies are so big today. You've seen the kind of valuations pharma is picking up today, all because you need to do the right things, right? And you look at the fines, right? And one should not be uncomfortable with them. The fact is you're getting fined for doing something wrong. The problem is you cross a red light, nobody fines you, that's the problem. If you cross the red light, someone fines you, you learn a thing or two and don't do it again. So I look at this very, very positively, honestly.
so in this room we have a lot of young leaders, you know, future leaders, and they are going to be operating in a very digitized world, much more different than yours and mine that we've sort of navigated through, right? And there's going to be a blurred line between information and misinformation that's going to come their way at some point in time. So how do you think they can navigate this while ensuring that they leverage social media, digital, to their best abilities to build reputation for their brands, for themselves rather?
So the most important thing to my mind is master your craft. Whatever you do, do it well, right? Ultimately, that is going to come through. I think I spoke, my second last slide also had that, at the end of the day, what you stand for, what you do, you should know it very, very well. That's number one. The second thing is be very transparent and authentic. See, today we are talking about reputation. Authenticity is very closely linked to reputation, right? If that's a bridge you break, your reputation can go for a trip. So my suggestion would be always be transparent, be authentic. The third thing is, before you publish anything on social media, think about it a bit. Don't do it at 3 o'clock in the morning, right? So think about it a bit before you publish. You can publish anything, anywhere. You have a voice, but use your voice well, You can use your voice to shout, or you can use your voice to create music. All up to you. But choose wisely, because once you have made the choice drives you. So think about it before you publish, and be data driven. Be very, very data driven. You are in a world which is unlike ours, where we are perception driven, but you have data, and data can change beliefs, data can change thoughts much faster than anything can, right? So if you can stay away from, I think it should be like this, instead of saying these are the numbers and look at it, I think it will enhance your reputation big time. You will not get into arguments. And last thing, I think I talked to you about influence and response. See, when you navigate a world, two worlds, we navigated one, you're navigating two worlds. When you navigate two worlds, you have to understand someday, somewhere, something is going to go wrong. Somebody is going to say something about you, and so much things are going on today, deepfakes, blah, blah, so many things. What's important to understand is have a plan, that if something goes wrong, how do I respond? Your response will ultimately enhance your brand value. I think that's very, very important to always understand that I'm going into an open platform, someone can ask me something, someone can tell me something. The important thing is don't ignore it. Respond to it. It's very, very important. That's the way I look at it.
Thank you. I think we have some time left, and I would like to open this for Q&A because there's a lot of interesting things that Atish has to share, and I see there's already one lady over. Please.
Atish, how do you all balance between ethical business practices to competing business needs, medical practitioners, corporate hospitals, pharma companies, and social responsibility?
Okay, I think when we talk about competing with companies, I think within the boundary of ethics and regulations, everything is fair till the point of time it does not adversely affect the patients. I think that is something one has to keep in mind, right? You compete, get a product at a lower price, do it, but do not compromise the quality, right? So the important thing what I'm trying to drive here is companies have to compete in an open world, but it's up to the company to see that they don't cross the boundaries of ethics, right? And today regulations, compliances are there within the organization, but even in a real world, you and me, the world we live in, you can do the right thing or you can do the wrong thing, right? So values and believing in the values of the organization becomes so very important.
How do you think Indian companies have managed to navigate reputation conversations, especially because our mindset is it's an MNC drug, it's great, it's an Indian drug, quality might be substandard, there must be something, that's why it's coming to us at a lesser price versus what the other company is chasing us at. So how do you think, as someone who's been with two Indian companies and seen the growth of both these companies so closely, how do you think Indian companies have managed to sort of navigate this? And do you think we've sort of broken the shell with the consumer to sort of say that, Indian company reputation is at par as global MNCs, or do you think we still have a long way to go?
See, there are two things here, two pieces here. One is innovation, the other is quality, right? In terms of innovation, Big Pharma is still way ahead, right? Indian companies, we have 3 new drugs which has just come in. So in 77 years of independence. So innovation should not be confused with quality. But the general public always confused quality with innovation. So the general perception, say 25 years back, was also that multinational drugs work better, right? And maybe 25 years back, this was the truth, right? But today, over a period of time, India is the pharma capital of the world, right? Every alternate lisinopril or any antihypertensive or any cardiac diabetes drug, alternative, if you look at the generics, all come from India, right? The highest number of FDA approved plants outside of the US is India, right? So we make the best medicines in the world. There's no doubt about it. And I think only China and US can kind of compete with us. But yeah, there's a long way to go in changing that perception, because earlier days doctors used to believe this, that the innovator has the best quality. But today, with the new FDA guidelines coming in, the regulations changing, with Indian companies going global, you also have to see that your drugs have the same standard. You probably can't have two standards going to two places. So a lot of changes, but a distance to travel yet.
So you would say our reputation, we still have a long way to build that reputation.
We have traveled a distance for sure, right? We have traveled a distance. So you'll see most of the multinationals are pushing back from in India. It's an Indian, most of the market today is an Indian, with Indian companies, simply because we have traveled that distance. People trust us that if it is absolutely a branded generic, the big companies have the best quality.
Okay. Thank you. I think that was quite an exciting chat, Atish.
Thank you so
much for your time.
Thank you.
Thank you.
Thank you. Atish, request you to just be on stage for a couple of seconds. We'll take a picture here. And thank you for sharing your insights, and thank you, Sarah, for the conversation. I request Sarah to please present Atish with a Sparkle collaborative gift card for the NGO CRY, which works towards health, education and safety rights for children in India.